Woo! Good afternoon. So once again, my name is Gibran, and I was a Berhan Civic Fellow, and I, as the title suggests, spent my summer in Peru as a Civic Fellow. Diving right in, I spent about 8 weeks in Peru, 2 of which were spent in northern Peru, and 6 of which were spent in southern Peru. The first 2 weeks, I worked with an organization called Richmond Global Health Alliance, or RGHA. Dr. Rick Mays, who is actually a professor here at the University of Richmond, helped find this program. We were based out of a small town called Zania, Peru, which is about a 13-hour drive from the capital, Lima. So RGHA is basically a non-profit global health organization based in Richmond, Virginia, founded on 4 pillars: direct primary care, community health outreach, youth development, and service learning and mentorship. And their mission is to support financially and logistically the global health and international service efforts by students and professionals in the Richmond, Virginia community. What we did over there were 5 undergrads from UR, including myself, and we also had medical students from VCU, PT students, OT students, and pharmacy students. And what we did was, apart from Zania, we went into a bunch of different towns up to an hour away, set up day-long clinics, and just provided free healthcare, free medicine, and even walkers and wheelchairs for people who needed them, as determined by the PT and OT students. I got to shadow about 6 different doctors, including pediatricians and adult doctors, and it was really just interesting being there because the entire time all the patients spoke were, of course, Spanish, so we got to actually help with like translating and being a part of the entire process, not just sitting in the back and listening to the doctor speak to the patients. Here are 3 pictures. On the left, I have a picture just from the sunrise, which unfortunately the beauty doesn't really come out with this PowerPoint, where it was absolutely great. On the right is just the Peruvian flag with the mountain, and that is a picture of the 5 undergrads from UR. Right next to me on my left is Anna Schimmel, who was also with me for the 8 weeks and was also a Civic Fellow. Unfortunately, she has a broken foot and is having surgery today, so she cannot be here. The second organization I worked with, Asociación Viñaypac, which was in southern Peru. I spent about 6 weeks there, surrounded by the mountains, waking up, just looking at the mountains as soon as I woke up. It was truly beautiful. But the organization itself, they deal with 3 main things. Medical outreach, which is providing access to healthcare for underdeveloped areas and areas out of reach from the general Peruvian healthcare standard, which I'll get into shortly. They also work a lot with healthcare policy reform. Dr. Francisco Morales, who I worked with for the 6 weeks when I was in Pisa. Oh, by the way, Pisac is a small town, also about 40 minutes from Cusco, just like surrounded in the Sacred Valley region, just mountains everywhere. So he was based out of Pisac, and that's where I worked with him for the most. But he would go to Cusco every day and not only work with government officials to make change in the healthcare policies, but also work with other nonprofits, bringing in resources to talk about what changes needed to be made the most in terms of healthcare policy. And lastly, they also work with American health professional schools to organize medical brigades and bring them into Pisac and just the southern part of Peru to provide care. When I was in Pisac, I was a part of 2 different brigades. One were medical students from Stony Brook, and the other one was a PA school from upstate New York. So just some more pictures. On the left and the right, you'll see just us interacting with the patients, doing intake and triage. And on the bottom is just a picture of the PA group that was there. Yucay was one of the towns we went to provide care. And before I wanted to dive into the academic part of the program, I was going to talk about my host family who I stayed with. They were absolutely great. They welcomed us into their own family like we were their own. When I felt sick, because I had some street food, which did not sit well with my stomach, unfortunately. The big lady taking the picture in the picture on the left, she actually made me special food, made special tea, which none of it she had to do, and it was really, really nice having them for the 6 weeks I was there. So diving into the academic component of my Civic Fellowship, as well as just, these are all things that I talk about or discussed with my faculty mentor, Dr. Rick Mays. So talking about the Peruvian healthcare system, there are 3 main tiers in the Peruvian healthcare system: the health post, the post-center hospital, and the hospital. The first step for anyone who is sick has to go to the health post at first. That's just a small building with 1 doctor, usually, and a few nurses, and it's in almost every town in Peru, no matter how small the town may be. And they only are open from 8 to 5 every day, and they deal with the basic medical needs such as vaccinations and physicals, colds, coughs, etc. The next tier is the post-center hospital, and the third tier is the hospital, and they deal with increasing levels of injuries or serious illnesses. The post-center hospital and the hospitals are both 24 hours open, and they're only available in certain towns, and they cover like a larger radius area. The medical insurance in the Peruvian healthcare system is quite robust. The SIS insurance, it covers about 18% of the population and is mandated through the Ministry of Health, and it is basically in place for anyone living in extreme poverty. Most of the people who avail of this insurance are either men over the age of 17 or women who are pregnant and are in living in extreme poverty. The S-Salud is mainly for middle-class families and people who are employed. 9% of their salaries is contributed towards their health insurance by their employer themselves, and it's mainly just for people living in northern Peru. And it's not that it's mandated, that's just how it works out, which I'll get into my next slide. But that is about 20% of the population. The rest of the population either not insured because they feel they don't need it, or it's all privatized insurance. Something very unique to the Peruvian healthcare system is the 1 year of required service by doctors. Unlike the United States, after high school, doctors go into, right after high school, they go into medical school over there for 5 years instead of 4 years. It's either 5 or 6 years. But one of the years they're required to do service in a small town, either in northern or southern Peru. What this basically means is that not only do they get experience, but the Ministry of Health is ensuring that even the smallest towns have access to healthcare, no matter what, because otherwise most doctors would probably not go and settle down in these small towns and be available for healthcare access. Lastly, just a data statistic, there are about 1.12 physicians per 1,000 people in Peru, and the HWO recommends 2.3 physicians per 1,000 people. This is something Dr. Mays and I discussed at length, but one of the biggest reasons for that is also there is a massive amount of brain drain going on in Peru, where a lot of doctors train and go to medical school in Peru and then actually end up taking their USMLE STEP exams and coming and doing residencies in the United States and becoming specialized doctors. In fact, 2 or 3 of the doctors I worked with at RGHA in the first 2 weeks had done the exact same thing, because they were from Peru, they came back to do the brigade, but they just live in the States now. So just translating everything I said into what I really experienced in terms of Peruvian healthcare, because those are just facts and data, but these 4 points are what I really witnessed as part of my 8 weeks of being there. So in northern Peru, most people are under the S-Salud plan, which is for the employed population, and in southern Peru, more people are under the SIS plan. Upon reflection, I think one of the biggest reasons for that is the fact that southern Peru is, of course, in the mountains, in the higher altitude, and Lima is where most of the population lives in northern Peru, but also just the fact that southern Peru has a lower need for higher paying / specialized jobs, and so there's just a higher level of poverty in southern Peru compared to northern Peru. In terms of the language barrier in southern Peru, I think that also adds on to the fact that that is the case. While most of Peru speak Spanish, or they call it Castellano actually, so if you said Spanish they would get very angry at you. But in southern Peru, in the mountains, they have this native language called Quechua, which honestly just sounds like clicking noises. And if you don't know anything at all, it's very hard to understand it. But most of the people in southern Peru will speak Quechua and not Spanish or Castellano, which adds on to the fact that and this relates again to the 1 year that the doctors have to do service. Like a lot of them who go to medical schools in northern Peru do not know Quechua, so it becomes increasingly difficult to provide that. So while the concept is there and it's a great concept to have, it's not very feasible due to the language barrier. So they usually have to have nurses to translate for them from Quechua to Spanish, and then they understand from there. With that comes into the last point, which is the cultural differences in health descriptions between the North and the South. In the South, something we realized was that, for example, when they said they have pain in their kidneys, they actually meant pain in their lower back. Because, I mean, they couldn't really tell if they had pain in the kidneys, but it was just pain in the lower back, and that's how they would describe it. Another example we got really confused by all the time was when they said they had a sore throat, but they really meant that they had a headache, which makes absolutely no sense to me, even after 8 weeks, but that is just how it translated from Quechua to Spanish and Spanish into English. So that is just a little bit about the Peruvian healthcare system and reflection and based on my reflection what I understood. I also wanted to talk a little bit about the cultural similarities I found between India and Peru, because I thought it was really interesting throughout my 8 weeks to think about this. I am ethnically Indian and I grew up in a very Indian cultural based household, and these 4 things stuck out to me constantly during my 8 weeks. So the food was actually more similar than I thought it would be. A lot of the food in Peru was rice-based, and they always had a rice. They had some sort of lentil-based dish, and some third thing was either like usually French fries, but also usually salads. And that combination of having the 3 things made it very similar. Like something that was fried rice, not fried rice, but like something that was fried and an item that was rice, and then a protein. The concept of joint families is also very prevalent in Peru, like I showed from the earlier picture. The parents, the sisters, the brothers, and like the brothers-in-law and the sisters-in-law all lived in the same house all together. And that is something that is still very prevalent in Peru apparently, and as well as in India. And that also I thought was very cool to just think about, even though because they're so far apart. In terms of celebrations, the Peruvians first off like to celebrate anything and everything. They have huge parties, they invite everyone. And something that was really interesting was that one of the festivals we went to, they would all have these 2-liter beer bottles, but not everyone would not have one beer bottle, they would just have the same beer bottle, have the same glass, and just keep passing it around in a circle. And that was to spread love and just have the concept of family. And that actually happened in India too, which I thought was quite interesting. And lastly, the architecture. This one was kind of mind-boggling for me, but because I figured that a lot of the things that the Incan ruins that we looked at looked similar to me, I went online and did some research, and apparently they have found scriptures in India on some of the buildings that actually relate South America and specifically Peru and the Incan civilization to things in India. They still have no idea what the connection is. They're still trying to figure that out, but there is a huge connection. Just the buildings were very similar. The floor plans in general are supposed to be very similar. And also the agricultural concepts that the Incan people used are also very prevalent, very common with what the ancient civilizations in India used. So just before I wrap up, I want to talk about just some of my experiences and thoughts. I already touched on this a lot, but the difference in working between the 2 locations was huge between northern Peru and southern Peru. I found that in northern Peru, people were a little more rude to you. They were in general they came there to the health clinics, they demanded your attention, and if you didn't give them the answer they liked, then they would just curse at you and actually just leave. Whereas in southern Peru, they were super polite the entire time. I think Anna and I were thanked probably at least 5 times with every patient, and we were like, no, I mean, we're here to do this. And they'd be like, no, no, no. I think one of them tried touching Anna's feet or something to thank her. It was quite interesting. Spanish proficiency, that is something I had said was a goal for me at the first meeting we had before we left for Peru, and the first 2 weeks that I got there, I had highly overestimated my speaking. They would speak to me in Spanish and I would stand there and say 2 words and they would laugh at me because I clearly did not say the right thing. So it was quite interesting being there. But over the 8 weeks, it definitely increased and I was able to just hold full conversations. I still struggle to conjugate verbs, but that's okay. My host family kept laughing at me for that, that's fine. I could still understand and speak to them. The last 2 kind of go hand in hand. But before I left for this trip, I've been wanting to get into medicine since I was in high school. And before I left for my trip, I was actually unsure if that is definitely the path I wanted to go down, and I was considering a bunch of other options. Being on this trip, having this experience, and just being in Peru for 8 weeks, I think I really discovered my passion for medicine, and it's made me realize that this is something that I want to do for the rest of my life. And speaking to the last point, when I said figuring out who I want to be as a physician, I don't mean the kind of specialty that I would want to go into, just because I know that changes a lot when you're in medical school. But I think I've figured out, hopefully, who I would want to be with my patients and what kind of care I would like to provide, and just as a person, who I am as a physician. And lastly, my 3 roommates are in the room, and so they'll probably laugh at this a little bit, but I had to end on this. But the food in Peru was absolutely on the right is a dish of ceviche, which is one of their most famous dishes, and on the left is actually an alpaca burger. I had a lot of alpaca. Tastes very similar to camel if you've had that. I've had that as well. But the food was absolutely amazing. Throughout the 8 weeks, we had so many good things, and every time I would be shocked about how much better this meal was than the last one. Yes. So before I end, I just wanted to say some thank yous. Thank you to Dr. Burhans for and other donors who have funded to this Civic Fellowship, so I was able to have this experience. I want to thank Dr. Miller and Ms. West for putting everything together for us. Dr. Rick Mays, who was my faculty mentor, and he was there for us constantly throughout the 8 weeks, providing support and just talking to us whenever we needed it. Dr. Francisco Morales, who is in Peru, and Michael Cipoletti, who were my site supervisors and were also constantly there for support. The CCE staff who are also here, who have mentored me throughout my 3 years as a Bonner Scholar and just always helped me with whatever I needed. And also, I mean, she's not here, but I want to say thank you to Anna, because having someone you know for those 8 weeks in a country you're not sure what you're doing really helps, and it was just nice having her there as a friend. Thank you.